Today we'll be talking about nosebleeds, what to do if you have a nosebleed, what things work, what things don't work, common myths that people have that you don't want to do actually to treat your nosebleed, how to prevent nosebleeds, what to do if there's a recurrence of a nosebleed, and when to see a doctor. Let's talk about nosebleeds. What do you do if your nose is bleeding? Oftentimes when I ask this question, people tell me that they turn their head back. Other people say that they turn their head back and hit their forehead. Some people tell me that they put on ice. Other people tell me that they stuff their nose with tissue. Some people say they put a cool cloth on their head while tilting their head back. What is the right thing to do? Honestly, those are not my preferred methods, and I'll tell you why. So what you actually want to do is to sit up straight and lean forward. Why am I saying lean forward? Isn't the blood gonna come out? Yes, it is. I would rather that the blood come out this way. When you tilt your head back, what's actually happening is that you're still bleeding, you just can't see it. And that blood is traveling down your esophagus and into your stomach. Now, does the stomach like blood? No. So there's a greater chance that if you tilt your head back that you are going to vomit. If you vomit, that's only going to make your nosebleed worse. So it's better to just let that blood that's going to come out anyways come out onto the floor. While you're leaning forward, you want to apply the principles that we just discussed on how to stop bleeding. Now you wonder, well, how am I going to apply direct pressure on my nosebleed? Especially when I said stuffing tissue up the nose wasn't a good idea. Well, let me show you. So I want you to take your finger and I want you to touch your nose. If you touch this part of it, you'll find that it moves quite freely. Now I want you to go to the top of your nose or the bridge of your nose, and as you try to move that, you'll find you cannot move that. There's bone there. I want you to take your thumb and first finger and then just move those fingers down until you find a spot where half of your thumb and finger are on hard bone and half are on the soft cartilage. That is the place that you are going to apply direct pressure. The way that you do that is you press completely down. Now, many times people have a tendency to just pinch the top of the nose, but you have to go all the way down when you're pinching, and you want to pinch hard. You'll know that if you're pinching hard enough when the bleeding stops. You want to continue in that position for 5 minutes. After 5 minutes, you can go ahead and release and see if there's any blood that drips out. If you find that you are still bleeding, then go ahead and redo that. And you could do that for another 10 minutes if you'd like. If at that point in time you find that you're still bleeding, I would go to the doctor. While you're doing that, you can get some ice and put it in a washcloth and put that in a bag, and then you can apply that to the bridge of your nose while you're applying pressure to your nose as you have somebody take you to the doctor. Now, what happens if you come back from the doctor, you never went to the doctor, and your nosebleed starts again? What I would recommend is that you go ahead and blow your nose, let all the clots come out, and then reapply the same technique that we talked about before. If it works, wonderful. If it doesn't, then you may need to go to the doctor. Something that might be helpful for some people is something called oxymetazoline. It is a nasal spray that can be used in the nose to help with the nosebleed. However, if you have high blood pressure or heart disease or any medical problems, you should talk to your doctor before using it. Now let's talk about if you were successful in stopping the bleeding. How do you prevent it from recurring? There are a couple of things that you can do. Try to stay upright for at least 4 to 5 hours after a nosebleed. Try not to rub your nose for an entire week because every time you do that, you are likely to dislodge some of the clots that have formed and cause the bleeding to reoccur. Don't put anything inside your nose. That will traumatize your nose and cause it to start bleeding again. Also, lastly, when you sneeze with an open mouth. That will allow the pressure to come out of your mouth instead of your nose. Since we're talking about nosebleeds, the obvious question that everyone asks is, why do we get nosebleeds? And the number one cause is trauma. So try to keep those fingers out of your nose. That said, dry environments can often cause nosebleeds as well because the blood vessels of the nose are very close to the surface, so they can easily start to bleed. in summary, what do you do if you have a nosebleed? You tilt your head forward, you pinch your nose all the way down with half the finger and thumb on the hard portion of your nose and half of it on the soft portion. And you pinch that for 5 minutes, and you do not stop, you do not check until those 5 minutes are done. If after 5 minutes you're still bleeding, go ahead and do it for another 10 minutes. If at that point you're still bleeding, go ahead and go to the doctor. If you want at that point in time, you can apply some ice to the bridge of your nose. However, don't apply it directly to your nose. Use a washcloth to wrap the ice in so that you don't injure the skin. In order to prevent a recurrence, sneeze with your mouth open, don't rub your nose, don't put anything in your nose, and try to keep your head upright for the next few hours. And to prevent nosebleeds in general, try to keep your finger out of your nose. I hope you found this helpful. Nothing in these videos should replace advice of your doctor. Be sure to watch more of our first aid and safety videos.